When I first met Ben, I just knew there was something special about him. He's everything you don't think about when you think about lung cancer.
As a child, Ben always had just two speeds, and it was either he was moving forward at 100% or he was sleeping.
He's the kind of guy that could go out and run a half marathon and not have run the month before.
I love getting out for a run 3 or 4 times a week, and then just recently being on my bicycle for 2 or 3 days a week, and it's just right out my back door. I was working for the ski area 20 hours a week. I was working for the Forest Service 40 hours a week, and then I was taking 2 courses in graduate school working on a degree in range management. Because of my busy schedule, I thought it probably had caused a cold and a lingering, non-productive cough. After about 6 weeks or possibly 2 months of that happening, I decided, this isn't going away. I should probably see my family practice doctor about that. Did the chest x-ray and it came back abnormal.
I got a call from his primary care doctor. When I saw the chest x-ray, I immediately said that we needed to have a CT scan.
From the time I had a CT scan, it was 2 working days before I got into to have that ENB procedure done.
With the superdimension system now, we're able to really aggressively go after any nodule and get enough sample to where we can do molecular testing and offer targeted therapy to those who qualify.
We have been able to obtain specimens with less invasive procedures and make it much safer for patients to undergo these procedures. Once the tissue was obtained, we sent it to a laboratory for molecular genetic profiling. Because he had such an unusual presentation at such a young age, that he may have a variant of lung cancer with a mutation of one of his receptors that could be treated with targeted therapy. So we were hopeful that that will be the case.
Be able to know what I'm dealing with at such a quick pace was beneficial psychologically, emotionally, even physically. It made a big difference. I can't imagine having to wait, and I certainly won't forget getting that phone call and hearing that it was cancer.
It's surreal. It's hard to totally come to grips with what is happening with him.
I, as his father, of course, want the best for my son, and
It's hard. It's devastating, but hopeful. We're filled with hope.
Every doctor's appointment I had, a nurse would come in, turn to my dad, wanting to take his vitals or assuming that he's the patient.
People don't think about lung cancer in young people, especially people who are in their 20s or 30s.
And I think that speaks to the lack of awareness, even on the part of professionals.
It's been a terribly difficult journey this last couple months, but these people have made it a little bit easier.
I've felt like I've gotten better in the last 6 weeks. My cough has not totally gone away, but it's markedly less than it had been in the past, and I've been able to maintain the lifestyle that I've enjoyed for years.
So Ben had his first CT scan after he's been on targeted therapy. He got great news that the tumor has shrank, and a lot of the other nodules have actually gone away. So it means that he's responded to therapy. I'm ecstatic about it.
And that was great news to hear.
Great news.
Yeah,
it's great news.
Absolutely.
I learned a big lesson from Ben. Instead of being dejected and down, Ben's focus has always been about living. And what next? And what else can I do? And who else can I see? And what other clinical trials are there?
People think, well, there's just not very much I can do. But what happens is that all of these people with not very much they can do come together, and it becomes a very big something you can do.
We're here in Washington Park. There is a race with the Free to Breathe Lung Cancer Association. I was one of the fortunate folks that got to run. My hope was from this whole thing is that we can really spread the word about lung cancer and specifically help with the stigma that lung cancer only happens to people that are smokers. That this can in fact affect people that are like myself in their mid-30s who have seemingly led healthy, productive lives.